Health Quarantine Department of General Administration of Customs, DG Liu Haitao from the Border Inspection Department of National Immigration Administration, DDG Han Guangzu from the Flight Standards Department of Civil Aviation Administration to take questions on border control, prevention of imported cases. First, some updates on the epidemic. In the 24 hours of April the 5th, according to reports from 31 provinces, cities, Xinjiang Production and Construction Corp, new confirmed cases 39, including 1 domestic case in Guangdong Province, and 38 cases were imported cases. 20 in Heilongjiang, 7 in Guangdong, 5 in Shanghai, 1 in Beijing, Inner Mongolia, Zhejiang, Shandong, Zhejiang, respectively. New death, 1 case in Hubei. New suspected cases, 10. All were imported cases. On the day, newly cured and discharged from hospitals, 114 patients, those of medical observation, numbered 2,151. Severe cases were reduced by 30. On the imported cases, remaining confirmed imported cases 693, including 22 severe cases. Remaining suspected cases 88. Cumulatively confirmed cases 951. Cumulatively cured and discharged from hospitals 258. No death cases among imported cases as of 24 o'clock April the 5th. According to reports from provinces, cities, and Xinjiang Production Construction Corp, remaining confirmed cases 1,299, including 265 severe cases. Cumulatively cured and discharged from hospitals 77,078. Cumulative deaths 3,331. Cumulatively reported confirmed cases 81,708. Remaining suspected cases 88. Cumulatively traced close contacts 713,988. Those who remain under medical observation as close contacts numbered 16,154. In Hubei province, there was no new confirmed case, no new and remaining suspected cases in the province. Newly cured and discharged from hospitals on the day 69, and new death 1. All were Wuhan cases. Remaining confirmed cases 577, including 574 in Wuhan. Severe cases were 234, including 231 in Wuhan. Cumulatively cured and discharged from hospitals 64,014, including 46,863 in Wuhan. Cumulative deaths 3,212, including 2,571 in Wuhan. Cumulatively confirmed cases 67,803, including 50,008 in Wuhan. According to reports from provinces, cities, and Xinjiang Production Construction Corp, new asymptomatic cases 78, including 40 imported asymptomatic cases. On the day, 5 were transferred to the category of confirmed cases. All were imported cases. Of medical observation from among asymptomatic cases 50, including 4 among imported cases. Those who remained under medical observation as asymptomatic cases 1,047, including 275 as imported cases. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,297, including 890 in Hong Kong SAR, 44 in Macau SAR, and 363 cases in the Taiwan region on April the 5th. Apart from Hubei province, remaining domestic severe cases were reduced to 9, and apart from Wuhan, severe cases in Hubei province were reduced to 3 cases. Precise treatment must be carried out. The neighboring countries have shown an ever-increasing pressure of exporting cases. Many provinces have reported imported cases. We have a mounting pressure in fending off the imported cases. We must keep an unrelenting focus on the prevention. Now we'd like to take questions from the floor. Please identify yourself before you ask your question. Journalist from the first row on the right side. With CCTV. On March the 16th, GACC, along with 4 other departments, have issued a policy circular on the prevention of imported cases and the punishment of illegal practices. It has been almost a month since its adoption. What has been the effectiveness of this policy? I'd like to ask DDG Song Yueqian to take the question. Thank you for your question. Since the adoption of the policy, customs at all levels have enhanced law enforcement and stepped up our efforts in cracking down on the illegal behaviors. After almost a month of enforcement, the 5-departmental policy has shown its effectiveness. Most of report their health conditions, but still there are a handful of travelers have hided their and concealed their symptoms. 6 cases that have been found by GACC showed that there were travel history of the inbound travelers who have traveled to some hotspot places but didn't report such situation. There were also travelers who took some medicines to decrease the temperature but didn't report. There were also the concealment of the coughs and fever of sailors. For these violations, GACC will give warning or highest level of 30,000 RMB as penalty. For severe violations, they will be transferred to law enforcement agencies to be held criminally accountable. We will adopt a combination of measures to increase the violation costs so that the violators will not be of impunity, will be blacklisted. Of their enterprises.
The owners or the business operators of conveyances punished. Their malpractices or illegal behaviors will be considered when the customs considers whether this company is a law-abiding enterprise. Fifthly, for people engaged in public administration or in the business activities with such illegal activities, they will be notified. Sixthly, for people who are punished by For instance, the potential lawbreakers for the entry and exit border control, they will be faced with more stringent customs control measures. Seventhly, the exposure of the malpractices will be strengthened. Apart from the related information of the lawbreakers on the related official websites, their credit rating will also be exposed to the general social activities. Eighthly, the local credit rating system will also include these law-breaking activities and related personnel. So in short, it will be of very severe consequence to break the relevant laws and regulations. Therefore, I urge people to act honestly, faithfully in the healthcare declaration form, as this is not only a prerequisite to safeguard people's health, but also a strong measure to ensure the safety and security in the society. Okay, let's continue. On the left, on the front row, the first lady reporter, please. Thank you. With Hong Kong China China Review. At the moment, we can see the pandemic is spreading across the world, and the central leadership team requests to strengthen the import control. So what are the measures adopted? We will have DG Liu Haitao to take your question. Thank you for your question. At the moment, the domestic situation is improving. However, we can see more and more imported cases. At the moment, the imported cases have exceeded 950. So it has become an outstanding issue to guard against the potential importation of the pandemic. The National Administration of Immigration is entitled to have the responsibility to take care of the potential risk of importation. So we have already taken it as a top priority. We are comprehensively strengthening the border control measures and set up a defense line against the potential importation. As for the specific measures, in short, we can say this is a three defense line approach. Before the entry, the related tickets affairs are well handled, and we try to get early access to the related information, conduct big data analysis, and identify the key targets. Also, for people who have traveled or stayed in the epicenter, they will be screened out and watched closely after. Second, we will notify the customs office and conduct the well-targeted quarantine and inspection. Now, the customs inspection officials have identified more than 300 cases, which accounts for a quarter of the total importation. Thirdly, at the second defense line is at the entry point. We have set up special pathways, and for every inbound traveler, we will conduct careful inspection and check the travel itinerary of the inbound travelers. Now, we have already traced more than 10,000 person times of such key travelers, and by doing so, we wish to guard against the potential spread of the pandemic. The third defense line is after their entry into China with the data support. We are trying to ensure information sharing concerning the domestic traveling of these inbound travelers. And such information is effectively and efficiently notified to the related authorities. So we have the coordinated approach to have the specific control measures concerning the quarantine and the concentrated inspection. And also we always act following the laws and regulations to conduct such control. Okay, let's continue. On the left, on the fourth row, the lady reporter with Phoenix TV. We noticed that recently many Chinese overseas wish to come back. However, the airfare remains high. So my question is for the civil aviation authorities. Do you have any plan to have chartered planes to pick up those overseas Chinese? Okay, we will have DG Han to take the question. Thank you for your question. Following the State Council and the Central Committee of the CPC's instructions, we have earnestly implemented the State Council's prevention and control mechanism. For destinations which have the capacity, we've already arranged the proper measures to bring back the stranded Chinese overseas. On March the 4th, or between March the 4th and April the 3rd, we've already arranged 11 planes to help 1,287 Chinese overseas from Iran and Italy. For Iran in particular, we have 6 chartered planes, and for the Italian, we have 4 planes, and for UK, we have also arranged such special flights to bring back the overseas Chinese. Most of them are Chinese students studying abroad. Okay, let's continue. On the left, on the third row, the lady reporter, please. Thank you. With Shenzhen TV. My question is also for CAAC. In the end of March, CAAC issued policies like to have specific entry points. And how about the result of this measure? We will continue to have DG Han to take the question. Thank you for your question. Starting from March the 20th, we have adopted the specific entry measure that you have mentioned. Then by April the 5th, 112 flights were rescheduled for their destination. And this has involved 18 countries other than China. Overall, we can see the arrangement has been sound. And with 3 weeks of practice, the various supporting measures have been improved and well conducted. Such measure has contributed to Beijing's efforts against the pandemic spread and also ensured the health and the safety of the inbound travelers.
On top of strict prevention control measures, these measures have also provided convenience to travelers. We are faced with grim challenges of prevention imported cases according to the deployment by the Interagency Task Force. We have adopted measures for rescheduling of the flights, and we follow the 5-1 principle. One airline company keeps one airliner flight toward back and forth for a country. Since the adoption of the policy, as of April the 5th, 112 international flights have executed their operations, including 24 international flights. Within these days, there has been an inbound traveler of number of 12,000. The daily inbound travelers have reduced from the original 25,000 to less than 3,000, effectively fending off the imported case risk. Next question, please. Journalist from the fourth row on the right side. Thank you. With CNR, we've noticed some netizens said the deliveries from abroad have come to their homes more slowly. Is this a truthful reflection of the situation, and what will be the measures adopted by GACC? I'd like to ask DDG Song Yueqian to take the question. Thank you for your question. Impacted by COVID-19, some of the airliners have reduced the international flights. So there has been some holding off of express deliveries. That's the major reason why the international packages have been slow coming back to China. GACC attaches great importance to the issue. We support the postal companies to improve coordination between the countries. And once the package has arrived at the customs, we will provide immediate custom clearance. Down the road, administration of customs will continue to collaborate with other countries to ensure the postal delivery pathways have been smooth and unfettered, so that the packages and materials can be very quickly cleared through customs. Besides, as the pandemic is spreading across the world, the outbound packages are faced with similar issues of prolonged delivery. We will support postal companies to set up some temporary postal pathways and unfettered pathways. Thank you. Journalist from the third row on the right side. With People's Daily, localities have adopted a consistent measure of 14 days quarantine for inbound travelers. We are seeing a visible controllability of preventing imported cases from the airway and the highways. So how do we fend off the imported case risk? On waterway, I'd like to ask DG Liu Haitao to take the question. Well, we have a borderline of over 2,000 kilometers, and there are 91 points of entry along the borderlines. There are also some shortcuts to provide convenience for the general public. So indeed, there is a high risk of highway imported cases. That's why NIA has adopted the following measures. First, we have a stricter control of unnecessary inbound and outbound travels, prevent the citizens from a third party to go through these points of entry, suspend the issuance of visa and permits to these inbound travels, suspend the passenger transportation function of these land points of entry, and suspend unnecessary travels, inbound travelers, and also citizens living around the border areas have been following the requirements. The inbound travelers have decreased from 26,000 to the current less than 10,000, a decrease of 80% and above. We've also exercised stricter control over these land points of entries. The previously closed land points of entry continue to be shut down. Seasonal points of entry will see their opening delayed. We have improved the safeguarding over these land points of entry. We have also carried out strict inspection over the transportation vehicles. We supported the provinces on border areas to implement the mass quarantine measures. For the outbound domestic travelers, the border inspection staff will look at the latest inbound traveling history. If they had a history of 14 days prior to 14 days, then they will be forbidden to go outside of the country. We collaborate with customs to improve the inspection and quarantine of transportation vehicles. For the inbound travelers or foreigners whose temperature is above the limit, they are forbidden to enter into China. We also strictly crack down on illegal inbound activities. And for the violators, they will be sent back to their original countries to ensure the border safety. Thank you. Next question, please. Journalist from the fifth row on the left side. Thank you. With JKB. COVID-19 is spreading rapidly across the world. All the cities as port of entries have conducted strict border inspection. For the inbound travelers, when they are put under mass quarantine, how can they protect their health? As you've rightly mentioned, to prevent the risks in transits and homestay quarantine, localities across the country have improved the quarantine over inbound travelers. We have a set of comprehensive measures. Apart from diplomats or the personnel engaged in major economic, trade, scientific research projects, almost all foreign passport holders have to be put under mass quarantine. Localities provide health knowledge to these foreign passport holders and inbound travelers. Temperature monitoring is conducted at least twice a day. They are inquired as to whether they have shown symptoms of dry coughs or some intestinal GI tract symptoms. Once such symptoms have been onset, these inbound travelers under mass quarantine will be timely transferred to health institutions for further screening or treatment if necessary. Journalist from the fifth row on the right side. Thank you. With China Daily. Previously, CAAC has suspended the chartered flights for official businesses. But now some of the official business chartered flights have resumed their operation. So what is the criteria? I'd like to ask DDG Han Guangzu the question. As pandemic situation changes, CAAC has timely improving and updating our work procedures. We have strict control over the vetting process so as to reduce the risks. On 17th of March, according to the prior to the adoption of the International Capital Airport divergence, apart from official business and emergency response, other official chartered business flights will be suspended. Starting from the March 25th inbound official chartered flights vetting process has been suspended. Those who apply to come into China need to provide a clarification letter. The destination airport must provide a reception notice before the chartered official business flight can come to China.
So this strict control measure has already generated results. Okay, we can only allow 2 more questions. Let's continue. On the left, on the second row, the second lady reporter, please. With China inspection and quarantine times, with the accelerated pandemic spread in the world, what are the measures adopted by GAC to guard against the importation? We will have DG Song to take your question. Okay, thank you for your question. With the pandemic spreads in the world, China is now faced with a mounting pressure to guard against the importation. The customs is the first line of defense against the pandemic, so we have adopted comprehensive measures to intensify the inspection and control and try our best to prevent the spread of pandemic. So the GAC has adopted the following measures. First, we comprehensively strengthened the medical quarantine on the inbound travelers. For all the inbound travelers, they will take the nucleic acid tests starting from April the 1st, together with the local governments. For all the passengers travel into China, they are requested to take the nucleic acid test, and all the information are transferred to the local joint prevention and control mechanisms. Also, a well-coordinated mechanism was established to transfer the inbound travelers. Second, we have adopted specific measures on the different population pockets or groups of the inbound travelers. For the air crews, just as I have said, they will take the nucleic acid tests, and if they don't leave the destinations, they will also take the nucleic acid tests, and they will also be sent to the local control mechanism for further treatment or inspection or quarantine. And for cross-border truck drivers, while strengthening the temperature check and the health declaration, the nucleic acid tests are also conducted with a selective approach, and also we have realized the closed-loop management on such personnel. Second, for the conveyances from the epic centers or conveyances that have carried the people from the epic centers, or on ships with sailors who have been to the epic centers, the declaration is strictly enforced, and the transfer measures are conducted in a very strict way, as well as the sanitation or the potential control, the various control measures are adopted. Okay, let's have the last question. On the right, on the second row, the third lady reporter, please. Thank you. With China civil aviation news, the CAAC for the first time revises the technical guideline. May I know the updates of this guideline? We will have DG Han to answer the question. Thank you. Thank you for your support to the civil aviation. CAAC has updated the technical guidelines in the light of the latest developments. In particular, as the pandemic situation abroad is changing all the time, we have revised the technical guidelines to advise the specific sectors. Compared with the third version, the fourth version compared the various requirements across the world and optimizes the self-protection plan for the crews and the related staff. Also, we have streamlined the border control measures and suggests the relevant authorities to adopt more stringent control measures. So we have the specific categorization of the indicators, and we have categorized the aircrafts as low, medium, and high risks. Also, we request specifically that the last 3 rows of the aircrafts should be identified as the quarantine area, and also the scenarios where the aircrafts would be considered as high-risk aircrafts. Furthermore, the specific requirements like the boarding procedures are also specified and provided with technical guidance. If the flight comes from the epicenter of the pandemic, then there should be specific control measures like the designated personnel for onboard inspection and check, and the use of the distance parking space for the aircraft. So by these measures, we try to effectively guard against the importation. Okay, on today's press conference, we have taken questions concerning the latest pandemic prevention and control measures, especially in the borders. The medical professionals are the mainstays in the fight against the epidemic or the pandemic. They have won the respect and recognition from people in the world. Tomorrow, we will celebrate this year's World Health Day. It's a unique occasion as the whole world is fighting against the pandemic. The theme for this year's World Health Day is in China is to show respect to the healthcare professionals and fight against the pandemic. So for tomorrow, we will focus on the treatment of the pandemic, and in particular, how the nurses are contributing to the fight against the pandemic. So we will have the WHO China representative as well as officials and experts in this in the health administration to take the questions from the journalists, and we also welcome your questions. That's all for today's press conference. Thank you very much.